Good evening, friends. A warm evening. A warm welcome to all of you, and especially to Bhupinder ma'am and Guruma. So today is day 4 and Monday, 8:30 p.m., 10th of June. So I request everyone to please concentrate in this session. And I also request everyone to please go through all the sessions regularly to be in touch with the next sessions. So a warm evening and smile evening to you, ma'am. I just hand over the session to you, awaiting the best session, ma'am. Thank you so much.
Thank you. Thank you so much. Thank you. Smile evening to everyone. So we will start our today's session, and our today's session is very special. Today I will focus how to treat your joints. This is very common disease. Like some people have knee pain. This is very I have seen this knee pain, a very common disease. Shoulder pain, wrist pain, yes, ankle pain, hip joint pain. So please pay attention to all those drawings which I will teach you, and then how to do it practically. Yes. First of all, when we talk about joints, you know that in this hand, these fingers, all these fingers are corresponding to our forelimbs. Middle two fingers are legs and side two fingers are arm, as we have studied in our previous class. And the joints you see on these fingers are corresponding to our extremities joint. And I will show you these pictures so that you can exactly focus the area where you want to treat. Now, first thing is, whenever you have any joint disease, joint pain, first tip is this ring. See this ring. And this is very simple tool, but it is actually a wonder ring. Professor Park Jae-woo used to say that this is wonder ring, a miracle ring. Sometimes we have observed that just by doing ring massage, your pain is healed. Only when we have little deeper disease, deeper pain, or deeper disease, then we have to do proper seed therapy, yes, and sometimes acupuncture also. But you will observe that you will observe yourself just with this ring massage, you can feel instant relief. It depends how much percentage. As I told you that if it is not very deep, sometimes pain you can feel 100% relief. This kind of magical effect takes place with this ring massage. And then second thing is moxa, especially for chronic diseases, chronic joints pain. I highly recommend to do this moxa. Only in that case where a patient has acute joint inflammation, in that case we don't do this moxa, or patient feels burning, yes, joints, burning sensation on joints. But chronic cases, very old disease, chronic means when I say old disease, in that case this moxa, it looks like cigarette. Yes. So now I have burned already, to save time, I have burned this moxa, you see. So after burning this, you can see this redness. Yes. So, you know, these are the joints, all these joints in the fingers. So I will just demonstrate how to do moxa on one joint, and the same technique you have to follow on all joints as per your target. If patient has knee pain, then you will focus on knee joint. If person has shoulder pain, then you will focus on shoulder joint. Yes. So after burning this moxa, you will do this And you can keep one saucer under your hand so that when ashes fall down, yes, it doesn't destroy your clothes. Yes, so you have to do moksa. Now when you're doing, and keep your hand, I think you see this way, like this, because if you keep like this, then ashes will fall on your skin. So better this saucer is there, and then like this, and two. Now see the distance. See the distance. You should not touch the skin. Also, don't keep very far from the skin, just little bit. And when you do it yourself, you will come to know that how much far you have to keep. Yes, you have to feel the warmth, and slowly, slowly, when you know, on one point, if you feel the peak stage of warmth, and then you move to next direction. See, if I'm doing like this, continue, 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 and now I'm feeling too much warm, then go next direction like this. So I'm just showing one joint, but this, as I told you, you can do the same technique for all the joints. And especially patient having chronic arthritis, where patient is suffering from multiple joints disease, multiple joints pain. In that case, finger therapy, you remember last session, I spoke about insect system, finger system. Please stay in touch with your sessions, because our future lectures needs that foundation. Day 1, day 2, day 3, and you keep receiving all these links continuously so that you can build up your foundation. On the basis of strong foundation, we will study all diseases and how to do treatment, because every time we cannot introduce the same topic. Yes, so you have a good opportunity, you have links of previous topics. Now, after doing this moksha on the joints, yes, you can select, as I told you. First thing is that you have to quench this moksha using little water. See, and check. Now it's okay. And before doing moksha, actually you do ring massage before moksha. It is very good. Yes. And as I was speaking about multiple joints pain, in that case, when you're doing moksha, please focus on the sidelines of each finger. You see, as per our last session, finger therapy, this side line, you see these dots, these dots are corresponding to our joints. I will touch this in detail. All these side lines of finger, yes, this is called yin yang line. As you know that front side of hand is yin, back side of hand is yang, and the center line, which is crossing between yin and yang surface, this line is called yin yang line. So, according to insect system, finger therapy, all our joints are located on the yin yang line. So, when person has a multiple joints pain and very chronic old disease, we can say like this, old disease, then this moksha on all the yin yang line, you see this yin yang line, and this not only on one finger but on all the fingers. And don't move quickly, you have to feel the warmth. Yes, now see, like this, with clockwise direction, keep going up, and the distance not very far, not very near, like this, on all the fingers. Yes, this will give instant relief, and then ring massage. Yes, ring massage. And focusing, when you are doing ring massage, you focus, when you put pressure, you focus on the yin yang line, more pressure on the yin yang line, because front side of finger is representing front body, back side is representing back body, and right side, left side, yin yang line, these two lines are representing our arms and legs along with our joints. So, two important tips for starting your treatment, joint treatment, that is ring massage and moxa. Yes, and then we will do our seed therapy. And now I will share my screen, and one by one we will see all the joints and how to do treatment. Okay. Now, this picture, this is hand picture, and this hand is representing full body. Also, each finger is representing full body. But here today, we will focus joints disease. Now, you see, middle two fingers are legs, side two fingers are arms, and now we can see the joints. So, two legs, and you can see the joint just below the trunk. This is hip joint. This is hip joint. Then below the hip joint, knee joint. Below the knee joint, ankle joint. Very simple, not difficult, because hand is similar to human body. We have to just do copy paste. And then arms. In arms, shoulder joints are touching the trunk. So these are two shoulder joints touching the trunk. Below the shoulder joint, we have elbow joint. Then below elbow, we have wrist joint. Okay. Same way in the foot. When you see the foot, in foot, we don't have clear three lines as you see in finger. When you compare finger with the toes, you can see the difference. Finger has very clear expression of three lines, 1, 2, 3, because in arm we have three joint, in legs we have three joint. So you see three lines, very good expression of three lines on each finger. But in toes, you see, in toes, on skin level, we just see two lines, just two lines. But it doesn't mean that this toe has only two joints. This skin level line is only two, but when you bend your toes, first just below the nail, with this bending, you will know that one joint is just below the nail. On bending, you will come to know. And then come to center area, you bend little deeper, you can feel the second joint. And then on this level when you bend, then you will find the third joint. So skin level, in toes, you will see two joint, but deep inside, under the skin, on bending, you will come to know that each toe has three joint. Yes, so that is why you have to treat foot also, because chronic cases, it is highly recommended that you focus on your toes. So now, how to do the treatment, how to start this journey. Actually, if you do it accurately and if you follow this technique properly, definitely you will see the result. Now, before we start focusing on the joints, I want to tell that internal organs are related to joints, and which are these internal organs which are related to these joints. So now in this square part, this is the palm region, which has all digestive organs. Here, this you have to pay attention to the gallbladder. Gallbladder, like according to 6 key, these joints are controlled by AHA wind. Extremities joints are controlled by AHA wind, and internal joint, central part of body also has joints. This is controlled by wind. So it is very important to pay attention on the organs related to AHA wind. When I say AHA wind, also we can say yang wind. It is a very small point, but very powerful point, because this gallbladder organ is the storehouse of our wind energy. So joint disease means some disharmony on the level of AHA wind. Now in 6 key we study that structural pattern, structural circulation and functional circulation. So as because I know that we have many beginners, so I will not go very deep into structural and functional pattern, but two organs you have to really focus if you have joint pain or joint any kind of joint disease. One is gallbladder. Just a minute. Gallbladder. And second is large intestine organ. Large intestine. So these two organs, these two organs are related to AHA wind. Structurally, in structural circulation, gallbladder is AHA wind, and according to functional circulation, large intestine organ is carrying AHA wind energy. So, in a very simple way, you can understand that if person has joint pain, you should check the point of gallbladder and large intestine. If these two organs are healthy, then you will not have joint pain also. So it is not that sometimes patient says that my large intestine is okay, I don't have constipation, and my gallbladder is okay, I don't have any symptoms, any disease symptoms of gallbladder and large intestine. It's okay, but we need to release our wind energy. Maybe some obstacle on the level of energy. Sometimes structurally you cannot see or any physical expression, but definitely our wind energy needs little harmonization. You have to do harmonization. So along with the joint disease, you should focus these two organs. So now this is in the main system, and in both hand, this is right hand, large intestine. So you have to remember this area. And in left hand, This is large intestine and gallbladder area. Very easy to find in insect system. Very, very easy to find. For beginners, as I told you, finger system is the most easiest system in Sujok. That is why even children can catch this, can understand this, because you see, this is body, and in body, uh, top is head, below head is the chest, below chest is the abdomen, and it is finger system is the same: head, chest, abdomen. So here we have to focus this gallbladder point and large intestine point. Now, when you are checking, it is very easy in finger system. And when you are checking gallbladder point and large intestine point, uh, better we check on all fingers, because our main purpose is to find the most painful point. So I'll show now. First step is check all the points related to gallbladder and large intestine. I'm talking about very chronic joint disease. But if it is not very chronic, then just focusing your joints, it is okay. If deep problem, then only we can focus. And additionally, also, if you do it, there is no side effect. Now, I'll just mark for you. You can see this is gallbladder point. Yes, all fingers. Now, in left hand, you see towards the this side, towards the thumb side, how to find gallbladder point. In left hand, towards the thumb, lower phalange of each finger in this area. So you have to remember the direction towards the thumb. And here you can see liver, and gallbladder. Now, in case you don't know the accurate, yes, because from beginner point of view, I'm talking, if in case you don't know the accurate target point, no problem. At least you know that uh, in each finger, lower phalange, and in lower phalange, upper area, you have to stimulate upper area. So when you are doing ring massage, this finger, now you know. Just see how I'm touching this area. Now you can see this area. So when you're doing ring massage, focus this area more. See, in left hand towards the thumb, press more. And if you don't know it, okay, then you stimulate this entire area. You can focus this horizontal area, or in a very simple way. Still, if you could not focus that exact liver and gallbladder area, at least you know that each finger, lower phalange, is the room for liver and gallbladder. Also, large intestine is there. So in upper, gallbladder, and the lower part of this lower phalange is having large intestine point. So it means you can focus this entire area, no problem. Okay, if you can focus the point, like in this group, many participants are old also. If they can do it accurately, then it is very good. But for beginners, at least you can focus this entire lower area, this area. So this will cover a gallbladder point and large intestine point. So massage and focus this area. All 8 fingers, lower phalange, you will massage this entire area. Nice massage. So this is first step, gallbladder point and large intestine after doing moxa and ring massage, then ring massage on all joints, and then next is gallbladder point and large intestine point. So ring massage is good, but if you have, I'll give this probe tip also. I hope you have prepared your treatment box. We have this probe. Okay. If you can clearly target that gallbladder point and large intestine point, then with the help of probe, you can massage the accurate area. Accurate area. Yes. Okay. We will see in practical session also. Now, next thing is after this gallbladder and large intestine attention, next is that which joint is giving more pain. You can focus individually. First example, patient has shoulder pain. So patient can have left shoulder pain. Patient can have right shoulder pain. Then where is the point of left shoulder and right shoulder in basic system and insect system? Insect system, or we can say finger therapy. Okay, once again, finger therapy means when you see full body on one single finger. This is called, in our science, this is called insect system. Why? Because here we see contracted body. Arms and legs are contracted. This is extreme contraction of arm and leg you see in this fingered body. And because of this contraction, like insect arms, when you see insect grasshopper limbs are contracted. Yes. So because of this posture, available body posture is like insect posture. That is why Professor Park Jae-woo said this is insect system, because of this posture. Okay. But in a very simple way, finger therapy also you can say. Finger therapy means full body you see on the finger. Yes, this is called finger therapy. So according to finger therapy, we will find the joint. Yes, each joint we can see. We have 3 joints on the arm, 3 joints on the leg. We can see on fingers. Then we have another system, very popular system. This is basic system. Yes, standard correspondence system of hand. In hand system, we see full body on full hand, not on one finger. This is a difference between hand system and finger system. In hand system, we see full body from head to toe. This complete full hand is representing full body. And in finger system, each finger is representing full body. So, we will keep these two systems in our mind. Yes, and we will locate each joint on hand system and on finger system. So if patient has left shoulder pain and okay, how to find this left shoulder joint? So we have to know in left hand and also in right hand. So left shoulder problem, this is, please focus, you have to mark this joint. So where you will do treatment? In left hand, this is left shoulder, and in right hand, this is left shoulder. Okay, first thing is, please remember these points. Left shoulder. Okay. And if person has right shoulder pain, then this is in left hand. This is right shoulder, and in right hand, in right hand, in left hand, this is right shoulder, and in right hand, this is right shoulder. Okay, so your points are clear? So now because how to do treatment I will show just now after understanding the point. So first thing is, where is left shoulder point in hand system? Then where is right shoulder point in hand system? Again, in left shoulder, this is left shoulder in left hand, and this is left shoulder in right hand. Now, this is right shoulder point in left hand, and this is right shoulder point in right hand. Once this point is clear, very easy to do the treat. Now, where is left shoulder and right shoulder points on finger system? So, you see this kind of postures of arms and legs, this is contracted posture, contracted posture. So, here you can see in contracted posture, you will see two joints on one level. This is shoulder joint and this is wrist joint. Wrist joint is more towards the yin. Elbow and knee joint, then hip joint and ankle joint. So now, first choice is index finger. Of course, we can find painful point on all fingers, whichever point is painful, there we do treatment. But first finger, index finger, you can choose as a first choice, because according to tri-origin, this is hetero finger, and hetero finger has tendency to change quickly, and our main purpose is to treat disease quickly. From illness to wellness, we need a change. We need change from illness to wellness. Index finger has a very strong power of hetero force. So this change phenomena is there in hetero finger. So first choice is index finger. Index finger. Now, when you treat right side joint, in left hand, index finger, right joints are very clearly, you can see, available in this expansion area. This is my right hand. And because we are focusing index finger, so you just close, go down all these fingers and just focus index finger. So you can see this side is expanded area, and this side we have a contraction because of this valley, this web is here, and this is a more expanded area. So in this left index finger, right side is more clear and very good expansion is here. Yes, and this side is contraction. That is why in left index finger, right joints treatment is very easy and also very effective because of this expansion surface. This is also expansion side of this finger. And in right hand, this side is, you can see this is expanded area. Okay, so in right hand, left joint treatment is very good. Left side joint. If person has a left joint problem, then in right hand, left is easily available, though you can treat both side. Okay, now see my finger. So this is my left index finger, you can see two dots horizontal level. Yes, yang side. Okay, first I'll show here. Okay, so this is left hand. In left hand, this gray part, this is showing nail area yang surface. So when you see like this is like, you can imagine here yin yang line. This part, nail side area, this is yang side, and front side area, this is yin, and middle is yin yang line. So nail side is yang, then this bending finger, this area is yin, back is yang, and this side line, this is called yin yang line. So we are focusing joints on the yin yang line. Now the same finger, my left index finger, I will show here. I will explain here. Just pay attention. So nail side, this is yang, and this is shoulder joint, right shoulder joint. If you focus, and you can take screenshot also, because I know if you do treatment correctly, you will see instant result. For example, patient has frozen shoulder, right frozen shoulder. Okay, right frozen shoulder. So this point is available. Here you can do the treatment. How to do treatment we will see in final practical part. So this is right shoulder joint. Yes, and in right hand, this is right hand index finger, this direction. See this direction. Nail side yang, front side yin. So in right index finger, this side. Now this blackish is this is yang surface under the nail. So this is left shoulder joint and left wrist joint. Now elbow joint. For example, patient has tennis elbow or some inflammation in the elbow and or some pain, any kind of elbow disease. In left hand, this is right elbow point. Sometimes just one black pepper on this point, you can see immediate relief. After stimulation, just apply, fix one seed here, black pepper. So this is right elbow on the left hand index finger, right elbow. And this is left elbow on right hand index finger. Then come down, knee joint. In left hand index finger, you can see this line very easy also. This point is right knee point. And here on the right index finger side line, on side line, this is left knee point. When you come here in left hand index finger, this is a right hip joint, and this is a right ankle joint. Then on right hand, this point is left hip joint, and this is left ankle joint. Okay, you can imagine like this. See, it is easy to visualize. So this is right area, right, all right joint. So this finger, is left hand index finger. This is the same finger. So you can visualize like this. Arm in a folded condition. That is why just below the nail, we can revise. Right shoulder joint. Right elbow joint. Then right. This is right wrist joint. Again, right shoulder and right wrist. Right elbow here. Right knee. And this view is of left side. Left shoulder, left wrist, left elbow, left knee, then left hip joint, and left ankle. So I wanted to explain, and now quickly we can see one by one. So now next case is, let's say, next case is elbow pain. Now we will focus individual joint. After understanding this, after seeing this complete view, full view, we will focus individual joint. So elbow disease, any kind of elbow disease. Elbow disease, this is in left, now in basic system, this is the point for left elbow and right elbow. And in right hand, left elbow and right elbow. So we will focus here. And where is elbow now? Just concentrate on the elbow point. In left hand index finger, this is right elbow and this is left elbow on right hand index finger. Okay, so this area we have to focus. So please keep these points in your mind, because not always patient is having all joints pain. Sometimes just one joint pain. Then elbow, then we can take wrist pain. Wrist pain. Wrist pain. Left wrist pain and right wrist pain. This is left wrist pain and right wrist pain in left hand. And in right hand, left wrist pain and right wrist pain. And in insect system, in finger system, this is in the left index finger. This is right wrist point and this is left wrist point on the right hand index finger. Okay. And now knee disease. This is very common disease. Knee pain, very common disease. So in basic system, in hand system, this is left knee and right knee. Okay. And in right hand, this is left knee and this becomes right knee. So this is knee point in hand system. Where is knee point in finger system? So in left index finger, this is right knee, and in right index finger, this is left knee. Okay. So now, where is ankle point? If patient has ankle joint pain. So in left hand, this is left ankle joint, and this is right ankle joint. In right hand, this is left ankle joint, and this becomes right ankle joint. Okay, now where is ankle joint point on finger system? In left hand index finger, this is right ankle joint, and in right hand index finger, this is left ankle joint. Now hip point. Hip point. If person has hip joint pain, so in basic system, this is left hip joint point, and this is right hip joint. In right hand, this is left hip joint and a right hip joint. Why I am showing on both hand? Because in old diseases, it is very, very important that you treat in both area. Why? Because as a beginner, we are not searching the painful point. Sujok therapist, if you are a Sujok therapist, then you can focus one point only, because sometimes one small point can do miraculous healing. So we have to master this one point with our retail knowledge. But from beginner point of view, better we focus both hand so that we don't miss. Yes, we don't miss any point of the target joint. Actually, in this hip joint also, we have many around this. This is not just front. This joint is about this all four direction, front, back, left, right, like a ring. Yes. So if I am showing front hand, it doesn't mean that this joint point is only on the front side. It is complete joint. Yes. For example, according to basic system, this is left ankle. So this is this ankle joint means all front, back, left, right direction. So hip joint. Where is hip joint in index finger in insect system? In left hand, this is right hip joint, and in right hand index finger, this is left hip joint. Okay. Now we'll talk about treatment part. Okay. So for this, I will change my camera. Okay. Just a moment, please. I'll just change my camera.
Ma'am, few wanted for toes and fingers also, please.
Yes, yes, I will. Definitely. I will. Now, once you learn the joints on hand, then it is very easy to find on foot. Very easy. For example, see, for example, now this is uh, left hand. Yes, and this is left foot and yang surface. Don't forget that this is yang surface, nail side. Okay. Now, in left hand, if you said that this is left shoulder joint, this point, this is left shoulder joint, then you see the same pattern. My picture is not moving. Can you see? I see fixed
Moving,
camera. It is moving?
Yes, ma'am.
Don't focus this drawing. This is just some partial system drawing. You have to just focus the finger area. Okay, let me show, because on my screen, this picture is fixed. So please focus just a moment. I'll show. First, I'll explain this and then I'll show practical part. How to recognize joints on foot. Okay, it is very simple. Once you master on your hand, then very easy to locate on foot. For example, this is my left hand. Yes. Now see, in my left hand, when you see yin surface, you see the direction of the thumb this side. So foot also, to match with the hand, you see the yin surface. See, yin surface. Yin surface. This is yin surface. My thumb is this side and big toe is this side. Okay. Now, left shoulder joint. This is left shoulder joint. For example, I'll mark. This is left shoulder joint. This black marking, can you see? So how to understand on the foot? If you have understood on the hand, you can do copy paste. So index finger, this last joint touching the square part is your left shoulder. Now in left foot, index toe, same. Last joint. This joint. This is left shoulder joint. If I say right shoulder joint, then in left hand, little finger, this side is right shoulder. This is right shoulder. Now, little finger, upper joint is right shoulder. Copy paste. In left foot, little finger, last upper joint is your right shoulder. If you know that left knee joint, this is on the middle finger, middle joint, because you have seen all the pictures now. We have focused each joint. After recognizing on the hand, copy paste on the foot, same pattern, same direction. Yes. So, for example, now I'll ask, you can write in the chat box. If patient has right shoulder pain, now I'm talking about right shoulder. So you have understood in right hand, this is index finger, upper joint is right shoulder. Can you tell me where is right shoulder point in right foot? If you can write in the chat box. Very simple. Right shoulder in right hand, index finger, upper joint is right shoulder. In foot, now I don't have a right foot picture. In foot also, right, you can say like this, right index toe, upper joint is right shoulder, same. Right hand, if right hand, middle finger is right leg, in foot also, right foot, middle toe is right leg. In left hand, if middle finger is representing left leg, then in left foot also, middle toe is representing left leg. Did you get the idea? Yes or no? In chat box, you can write. Yes? Very good. Okay, very good. So once you recognize on the hand, same you can do on the foot. Yes, same match with the foot. Okay, now treatment part. I will show on my hand. So I'm sharing my screen now. Just a moment. So first of all, ring massage, I already told you, you have to do ring massage on all fingers. On all fingers, you have to do ring massage. And then uh, you have to focus your target area. If patient has knee problem, then you will do ring massage in this area more. Additional attention, VIP treatment to knee joint area. Yes, so this is left knee, right knee. Now I will show one joint treatment, and then you can follow the same pattern on all joints. So left knee. So first is ring massage. In left hand, this is left knee. In right hand, this is right knee. But ring massage, you don't jump quickly from one finger to the another, because you have to do ring massage until the skin becomes pink color. Don't press deep. Also, it should not be very superficial level. It should be pleasant pressure. Pleasant, I can say pleasant pressure. Yes. And if you can find the painful point, I will give you both technique. In case you succeed, then it is very good. If you don't succeed, then we can fix this. We can cover this joint with seeds. So one by one, you can check. But this side, in basic system, for finding left knee point, this is the area you can massage. We can find the painful point also. And wherever you find the painful point, you can press, you can apply just one seed. The right knee, this area. But in case, now this is for left knee and this is for right knee. Now, in case if you don't know how to find the painful point, then at least you can start your treatment with this chain. Yes, lots of seeds on one paper tape. After doing ring massage, cover this joint, cover this whole joint like this. And then one more paper tape to give support. Additional. Just a minute. Broad tape. We need broad tape to cover this area. So anyway, I don't want to waste time. I cannot see that edge, but idea is to wrap this area, give support to this small tape also, because you see now if you do it, if you just leave it, then seeds will come out. So that is why we need this broad tape also on top of this. See, one more tape. Okay, now if person has, see, now we can focus all joints one by one. Same technique you have to do it on basic system. Once again, left knee, in left hand, see, left knee, right knee. In this hand, left knee and right knee. Now, because this is very common. Now, left hip joint and right hip joint in left hand. In right hand, left hip joint, right hip joint. Then ankle joint, left ankle, right ankle. And of course, foot, don't forget. Same, copy paste. Right hand, left ankle, right ankle. Then shoulder. In left hand, left shoulder, right shoulder. In right hand, left shoulder, right shoulder. Then elbow, tennis elbow, any kind of elbow pain. Left elbow, right elbow in left hand. In right hand, left elbow, right elbow. Next is wrist joint pain. In left hand, left wrist, right wrist. In right hand, left wrist and right wrist. Yes. So after understanding the joint, any joint, if you want to treat, first you will do ring massage, then you will do moxa. You will do moxa. As you have seen, there are actually different kinds of moxa. This is stick moxa. We have smokeless moxa also, as we saw initially. So you do moxa around the joint, and then seed chain. You can cover this joint with the seed chain. Okay. Now, after knowing these joint location, also I can say you can do twist also. Sometimes just twist massage can give good healing. For example, patient has knee pain. This is left knee. This is one sample, one example, and then you can apply on all the joint points in the correspondence area of all joints. So this left knee, first is massage clockwise and anti-clockwise. This is with pressure, but this pressure is not very hard pressure. Please pay attention that you don't create any wound here. Yes, you don't damage the bone here. It is skin level twist. If person has frozen shoulder, left shoulder frozen, then this is the area. You have to do skin twist like this. See, you can see the wrinkle when I'm twisting. This is skin level. And then release. Anti-clockwise and release. Yes. So you can do this manual massage also. If you don't have this ring, manual massage. Nice massage. Nice. And also massage the surrounding area. Yes. First focus the main area and then you can massage the surrounding area. Nice. Like this. If person has left wrist problem, let's say, I'm giving you examples. And the same technique for all the joints. This is left wrist, massage nicely and clockwise and anti-clockwise. And then you have seeds, fenugreek seeds. These are fenugreek seeds. And you have these seeds easily available in your kitchen using this paper tape, this size and this size tape you need. First with this narrow and then second overlapping with the broad tape. Now next thing is I want to focus gallbladder points. as I told you, in insect system, gallbladder point is very good for giving good result. Gallbladder point and large intestine points are very important in joints diseases. So this is the gallbladder point. Check one by one. Check one by one which point is more painful. For example, patient has more pain here. Then with the help of, first you do massage and then just one black pepper is enough. One black pepper. This is one black pepper seed on the most painful gallbladder point. If like patient has knee pain, left knee pain, so you will do left knee treatment as I discussed with you. So you do left knee treatment. Along with this left knee treatment, find the painful point of gallbladder. So this point is also important along with the left knee joint. And then, as I told you, large intestine. Where is the large intestine area? So in this lower phalange, this is large intestine area. This is large intestine area. So you can just do massage. Actually, for beginners, if you cannot exactly, you can focus gallbladder and large intestine, you can massage this entire area also. And then you can cover this last area with the seeds, with fenugreek seeds or green lentil. This entire area you can cover. Okay, now I want to show insect system. Better I show on this screen. See. Now how to apply the seed on the insect system point. So we need in insect system, we just need one seed. Okay. So we have done practice of joints on finger. Yes, you can revise your lessons and where is the disease, according to that find the point. So let's say right shoulder frozen, I cannot lift up. For example, dummy patient, I'm dummy patient, I have left shoulder pain, right shoulder, this is my right shoulder. So on left hand, very easy to find. This is, you see the dot, this is right shoulder. This is right shoulder. Right shoulder. So this is right shoulder. Actually, this side, if you come, this is left shoulder. And this is right shoulder. But I told you that the expansion area is very convenient for treating. This in left hand, this right side is very convenient. So this is my right shoulder. You press this point. Press this point. Press, release, press, release, press. And then also zigzag, zigzag, like scratching. Stimulate this point. Little deeper pressure, but at the same time, not so deep. As I told you, no wound. You cannot create a wound. So this is right shoulder. And in this finger also, we have right shoulder point, but this side. First choice is this point. Okay. So now in this finger, we can see all points because in picture you have seen, but in real hand also we can do revision. Right shoulder, you see the technique, the drawing part, same you can see here also. So index, this is left hand index finger, right shoulder towards the yang side. This side is left shoulder. Okay. Then front side, this is right wrist. right wrist, and on the same level, this is left wrist. Then see, this is right elbow. On the same level, this side is left elbow. Then right knee, same level, this side left knee. Right hip joint, back side. This is yang surface. Towards the yang surface, this is right hip joint. On the same level, this is left hip joint. Right ankle joint. On the same level, this side is left ankle joint. And same way in right index finger also, quickly we can revise. For arthritis, this is very good choice. Finger system, multiple joint, very good choice. So this is my right hand, right index finger, left shoulders. First see the pattern. So left shoulder, this side is right shoulder, same level. Then front side, this is left elbow, this side, and this side, same level. This is my right elbow. Then this side, right, sorry, wrist. This was shoulder and wrist. Here is, once again, I want to say, this is left shoulder, right shoulder, left wrist, right wrist, then left elbow, upper point is right elbow, lower point is left knee. This is left knee. Then this side is right knee. Then you see this point towards the yang surface, this is left hip joint. And this side is right hip joint. Then towards the yin surface, this is left ankle joint. This side is right ankle joint. So if person has, let's say, left wrist pain, now you can choose as per patient's disease, as per patient's joint pain. So if patient has left frozen shoulder, so you can just 1 black pepper, left shoulder. In right hand, as I told you, in right hand treating left joints, this is a good choice. So you can see this point. On this one point, after doing massage, 1 black pepper, on this point, and you can wrap like this. So now, how many days, how many minutes we can discuss this point? So after applying the seed, you can keep this seed for minimum 6 hours, maximum you can keep 20 hours also, no problem. Before sleeping, you can tie this seed, and next day morning you can remove this. So seed therapy will never have any side effect. Only thing is that some people, they have sensitive skin, and because of this sensitive skin, sometimes rashes they can see. So in that condition, you can tell your patient, if you are feeling discomfort on skin level, you can remove this seed. But if patient is not feeling discomfort, then it is very good idea to keep these seeds for 8 hours, very good, or more also you can keep, no problem, more also you can keep. And then next day, when you apply seed, again check the point. Again do the same procedure. See, if you really want to see the result, please follow it regularly. Sometimes you will see the result in first day itself, sometimes in second day, and in chronic cases, maybe you need for 15 days. But I'm sure just with first sitting, even this disease is very chronic, very chronic. First sitting, definitely you will see some result, some percentage of relief, definitely you will see. And then you can do treatment, at least better you do it for 15 days. After 15 days, because you will see the result, and if patient needs more, body is demanding more, you give, because this is very natural. One seed is not a big thing. Even if you do it every day for 3 weeks, it is good. Yes, we have to treat from root. Okay, don't miss this. And once your disease is cured, then for general fitness, you should do this ring massage every day. Every day. Yes, just for like you do body yoga, you do face yoga. This is also, we can say this is finger yoga, doing clockwise and anti-clockwise massage and doing ring massage. You can do this. Okay, now in some cases, we can also do colors. Like I have seen, if patient has swelling on knee, swelling, then green color, as per Sujok 6 key therapy, we have actually color therapy we can do from 6 key consciousness, from Ayurveda consciousness, from Triogen consciousness point of view, but I'm telling from 6 key consciousness. So if person has swelling, then you can do green color on the knee joint. What you can do that uh, in daytime, you can put green color on the joint. Like left knee swelling, you can put green color and keep it for 2 hours open. Don't do seed therapy. And after 2 hours on the same joint, you can do seed therapy. So you will see great result in swelling. Maybe first day your swelling is reduced. Green color for swelling. In any joint, ankle joint swelling, you do green color. Stiffness on the joint, no movement on the joint level, any joint is having this stiffness or no movement, then green color on the joint, we say in the correspondence area, or I can say that green color on the target joint. And if person has inflammation or feeling hot or feeling warm, when you touch the skin, the area is warm, then uh, in your real knee, I'm talking about your real joint, and the points are here. Okay, colors you are doing on the Sujok platform. After recognizing, for example, left shoulder, some heat condition is there. If you touch this area, you can feel hot or you can feel warm. Then in the left shoulder point, according to hand system, this is left shoulder. You can cover this area with blue color here, and then after keep it for 2 to 3 hours. After this color therapy, you do this seed therapy. Okay, first you do color, uh, and in case you don't know the cause, you don't know what is happening inside the joint, because if swelling is there, you can do green color. If person is feeling hot, you can do blue color. But if patient is just having pain or some there's so many diseases, joint diseases, but if we don't have clear indication after studying 6 key Sujok, this is higher level, third level we study, in third level we study 6 key. After understanding the medical reason, we can choose colors accordingly. But now I'm teaching from beginner's point of view. So, and also if person has some uh, degeneration of joint, in like medical report says degeneration of joint, then a red color on that joint. I like to do red and green. One day green color and second day red color. You can keep it for 2 hours. And give pause also. Pause and don't use permanent color. Don't use. We have to clean after 2 hours with alcohol. After 2 hours, we should clean and then do seed therapy. Okay. So, first is again, I want to summarize. Whenever person has joint disease, first thing is you should do ring massage on all the joints and VIP treatment on the main target disease related joint. In that area, you will do ring massage more. 2 times a day or 3 times a day, you can do, and you don't need special time. You can do it while watching TV, yes, or while talking, before sleeping on the bed, or when you get up in the morning. You can do clockwise, anti-clockwise massage, and also you can do moxa. You should do moxa in chronic old cases, and then you do seed therapy. Yes, and you will see the result. Okay, now I'm opening question answer session. You can open your mic, you can unmute yourself. If you have any question related to joint diseases, because our today's topic was joint treatment.
I request everyone to raise your hands and please switch on your videos. It's a must. Then only you will be given permission to speak. Thank you. Swati, please unmute.
Hello, ma'am.
Hello.
Ma'am, as for today, the gallbladder point that you showed on the left hand, can you please show the same on the right hand? Is it the same position or it will change? This towards thumb.
Actually, when you see, when you overlap your finger, then gallbladder point is coming in the same place. So here you have seen gallbladder point this
Yeah.
in this place, and
Yes,
overlap, it is coming in the same place.
same place.
Same place.
Okay. Now, second thing, ma'am, when you see the foot, like you say, you have to do the sujok. So do we put our foot like this and imprint the hand, which is like this?
Okay, see, if you are you can keep like this or like this, no problems. For example, show me the left knee joint in left hand. I hope you have understood in
Yes,
hand.
yes, one minute.
Show me where is left knee joint in left hand.
Yeah.
Just show me so all people can see. Okay, now correct. So this is in left hand,
Correct.
middle joint.
Yes.
Whether you do like this or do like this or like this, you are now aware that left hand, middle finger, middle joint is left knee.
Correct.
Now transfer this on the left foot without looking the foot. Don't look foot also.
Okay. Okay.
Just see. This is middle finger. It means
The middle
left foot,
finger.
middle toe.
Okay.
This is middle joint. Then middle
Left
joint
foot.
means middle toe, middle joint.
Okay.
You don't need to see also.
See also. Okay, fair. That
Yes.
is
I
second.
hope clear.
Yes, ma'am. And the third thing is when we are seeing the hand, the bigger picture, the liver on the left hand goes this side. Yes. Correct, ma'am? Yeah, I got it. Like this side, right? On the right hand, it is here.
See, again you do overlapping. Both livers are coming in the same
Okay,
direction.
understood. Now, ma'am,
So
the heart and the
liver
lung.
is.
So the heart and the lung comes in the similar area, like how you overlap. So the liver is here.
Yes, don't concentrate heart and lung now. Maybe next lesson in our coming series, coming sessions, I will focus. We have overlapping
Okay, fine.
overlapping situation with this. I have to explain overlapping properly, then only we can understand. But yes, I will just clear your doubt that in this area, because of this tilted thumb, you see,
Hmm.
our body is standing in vertical axis.
Hmm.
Yes, below head is neck, below neck is chest, and below chest is abdomen. But
Hmm.
in hand, this head, you say this is the head, but you see
Hmm.
this is tilted, thumb is tilted. So
Yes.
head, neck, chest. So it is tilted. And because of this tilting situation, this chest is overlapping some part of the abdomen. So some part of abdomen is hidden under the chest.
Hmm.
Yes,
Okay.
this area we will study
Okay.
in our future series,
Future.
because today my target is joint pain, joint.
Yes.
If I
Okay.
take one target, it is easy to understand. If I mix up many, then it
Yeah,
can,
no, actually, I'd seen the picture. That's why
yes,
that
yes.
was missing. So I just wanted to clarify. I understood.
You see, this is overlapping condition. Chest
Fine.
is here. I will in future series I will explain that
Okay.
what happens if this comes down.
Yes.
But now
Understood.
we are focusing gallbladder point and intestine.
Okay. Thank you, ma'am.
Yes, please. Varsha ji.
Smile evening, ma'am. Ma'am, I want to ask that you said about the degeneration. It may be a fluid also.
Degeneration, when you see the medical report,
Yeah.
and medical report, it is written clearly degeneration. If
Okay.
quit a collection, then green color is good.
Okay.
Fluid, fluid,
Something. Yeah.
fluid. Yes. So anything
Okay.
related to fluid, then green color on the respective joint.
Okay, ma'am. And nowadays people are having that knee issues. Maybe gap is overlapping or some side is they have C-shaped knee. In that
Now,
case also we can.
just do it, and you have to experience now. Just do it.
Okay. Okay.
Though these are baby steps, in our Sujok, we have various levels, and according to the intensity of the disease, we are adding our advanced knowledge. But I have
Okay.
seen it many cases, more than 70-80 percentage cases. This technique which we have learned today as
Yeah.
part of our beginners class, it is very effective, even though it is big
Okay.
tips, but it is very, very effective.
Okay. And inflammation on ankle joint.
Inflammation like tennis elbow or inflammation in ankle joint, and then in that area, once you recognize which joint, then in
Yeah.
that area you apply dark blue, ink blue color around this joint.
Okay.
So
Okay.
that. Mm.
Okay. And any calcium accumulation over that area, we
Mm.
can treat with this also?
Yes, you can apply green color.
Okay, ma'am. Okay. Yeah.
But when you do color therapy, in that time, don't do seed therapy. As I told you, if
Yeah.
you're doing color in the morning, in morning time, after 2 hours, you will put seeds.
Seed. Okay, ma'am. Okay. Yeah. Okay. Thank you so much, ma'am. Thank you.
Madhubala, unmute.
स्माइल इवनिंग मैम.
Smile evening, smile evening.
मैम एक्चुअली ये जो जॉइंट में जो अभी आपने कहा जैसे आरए में जब ये जो बोन का जो डिजनरेशन होता है तो उसके लिए भी क्या रेड कलर काम आते?
जी, आप रेड कलर लगाइए, मोक्सा जरूर करिएगा.
एंड मैम मॉर्निंग जब उठते हैं तो जो हैंड होते हैं ये इनमें पूरे में स्वेलिंग होती है, कांट मूव लाइक दिस, और इसको बंद भी नहीं कर पाती मुट्ठी को, तो इसके लिए पूरी जॉइंट में पेन होता है इसमें.
This is good question, because this is finger, you're talking about finger joints.
Finger joint, हाँ जी.
Finger joints, yes.
Yes,
Because
ma'am.
we have discussed shoulder joint, elbow joint, wrist joint, but not finger joints.
Yes, ma'am.
Yes, so finger joints, just focus side to fingers, the points just below the nail.
Nail.
See,
Yes, ma'am.
these 4 fingers, the point below the nail.
Yes, ma'am.
Apply orange color or red color below the nail. Can you see color?
Yes,
Like
ma'am.
this?
Yes, ma'am. Yes,
So
I,
all these 4 fingers, orange color below the nail. But
yes, ma'am.
after this color, you can apply seed therapy after 2 hours. And more attention on these areas. You
Yes.
do ring massage, give more attention in these areas. Also moxa therapy in these 2 areas. And then seeds. Yes, with the help of paper tape, seeds.
Yes. Fenugreek seed, ma'am. Yes.
Cover this area with the seed. So even if you are touching extra part, no problem. But idea is don't miss this area.
Yes, ma'am.
For seed therapy in 4 fingers.
Yes, ma'am. Thank you so much, ma'am.
Is because this question is good because I did not discuss this. If again I want to repeat for everyone, if people having finger joints pain, then 4 fingers just below the nail, this area, this much area, you have to focus, moxa, color and seeds.
Ma'am, जब
But
morning उठते हैं,
also you do ring massage on all fingers because joint problem we have to, if person has one joint problem, 2 joint problem, it is very important to focus all joints because this joint is a complete unit network system. It is interacting with all joints. But more attention in these areas.
yes, ma'am. Thank you so much, ma'am.
Namaste, ma'am.
Yeah.
Smile night. Good night. Ma'am, actually, I'm suffering here from neck pain. So I can do a ring massage here.
In our last session, I have mentioned this cervical area, how to do this treatment, focusing back central line and side lines. You do day 3. Please see day 3 video. It is in
Okay.
your group.
Okay,
It is
ma'am.
it is floating in your day
Okay.
3 video.
Okay, ma'am. And one more thing is my daughter is suffering with the knee pain. Whenever she gets this weather changes from summer to winter, rainy and all, she feels knee pain. So I can use today's treatment for her and
Yes.
synovial fluid is less.
Yes, then please do it. You do this seed therapy and apply red color.
Red color for both the knees. Thank you, ma'am. Thank you very much.
See. Yes. Yes, please.
Good evening, ma'am.
Good evening.
Ma'am, I got yesterday itself the right hip joint pain, ma'am. I'm unable to stand and walk. I have to take support and walk.
This is the right hip area. In right hand, this is right.
Right hip.
So more attention here. And in left hand, this is right hip. So if you
And
revise
after
our lesson,
after
discuss this.
taking a hot bath, just I got relief from that. I put hot.
Okay, you did massage?
I didn't massage it. Where I didn't exactly locate that, ma'am, hip joint.
Your voice, I cannot hear.
Hello. Yes, ma'am. Is it audible?
Now audible, yes.
Yes, ma'am. I am unable to locate exact hip joint, ma'am. That's why I didn't.
So this is actually right hip joint, this joint. So when you're massaging, don't miss the surrounding area also. Massage until this bone. This bone you can feel here, bone also you will feel. Touch your palm area, you will feel the bony part also. So you massage this point, and because we have skin level and bone level also, actually your finger is ending on the joint level. So all these lower area joints, if person has any problem related to these joints, don't miss this area also. Massage this surrounding area touching this bony part. So if right hip problem, you have to massage this and this. Now to find the accurate point, you can use this probe. You can use this probe, and one by one, you can just check this area. You need to press, and wherever you get actually painful point, stop there and press, release, press, release in that area. Because you see in that, whenever you find the painful point, and when you succeed in finding the painful point, then on pressing that painful point, curative waves are released, which can cure the target area. And in finger system also, hip joint, right hip joint, this is the right hip joint. Massage this. Actually, we have right hip joint on all fingers. If you have understood this concept, then this point you can explore on all fingers. Try to explore, and if you find the painful point in little finger, you can treat there. But as of now, I have explained on the index finger, because this is the most easiest way to find the painful point on the insect system in outer areas. So if you revise your lessons, you will get your answer also. I touched this.
And which color we have to apply, ma'am?
You cannot, this is old problem.
Yes, ma'am. Sciatica problem I have.
Okay, sciatica, for sciatica, you have to treat lumbar area. Please refer your day 3 recording, day 3 class. Please revise your day 3 class. You should treat lumbar area along with the hip joint area.
Okay.
Good evening, ma'am.
Good
Good
evening.
evening, ma'am.
Good evening. Good evening.
Good evening, ma'am. Ma'am, I'm having back side of below thumb to knee. I'm having the thigh side is very tightness, ma'am.
Hi,
Very
hi.
both the legs, thumb to knee, thigh.
Thumb to
Backside bum to knee.
bump to knee. Okay, okay.
Yes, ma'am.
Yes, yes. So now this is not joint. This is the area of thigh. Thigh. Mean to say thigh. So you see, first you understand that if this is thigh, left thigh and right thigh, then just below the hip joint, this is hip joint. Just below the hip joint, this entire area is thigh region. This is complete thigh region. And in
Yes,
this hand, this is right hip joint. So this area is thigh region. So focus more in this area. This
Okay,
area.
ma'am.
This is area.
Okay, ma'am.
And this area. More ring
Okay.
massage. Do
Okay,
massage
ma'am. Okay, ma'am.
3 times a day.
Okay, ma'am. Thank you so much.
Okay.
Kumaran sir, please unmute.
Smile evening, madam.
Good evening.
I hope you can hear me today.
Yes,
Last week,
Your
madam,
voice.
last week I mentioned about my severe pain on the soles of both the foot, and you advised me to apply pepper one day and then fenugreek next day. Like that, for the last 6 days I did that. Also massage. something you mentioned, I forgot about a color. You asked me to put a color also on the yin yang line. It was yellow or orange you mentioned, I believe. And that I have not done, but other things I have done. And this is chronic for the last 2 years. This pain was there. And
Can you
I'm not.
just give quick glimpse of your disease, because I need to hear once more. Quick glimpse.
But
Can you explain your disease? Can you summarize?
but deep pain on both the soles only.
Souls. Okay, souls.
No,
Deep.
no other disease. No BP, no sugar, uh, nothing of that any sort. I have done thorough checking also, and
Also, you
you
add,
advise.
yes, also you add foot. Both,
Ah,
yes, both feet, middle toe,
ah,
this part. See,
yeah,
this area,
ah, ah,
massage
ah,
area. You can
ah,
use ring massage.
ah,
And then after doing massage in this area,
ah,
methi seed, fenugreek seed in this area,
ah,
nicely, tightly,
very good.
not
Ah,
very tight. It should not stop your blood circulation,
yeah,
but not loose also. So
right,
after taking bath in the morning,
ah,
so both both feet, this
ah,
area,
ah,
to doing massage, tie
yeah,
fenugreek seed like this.
ah,
Fill this area like this and
yes,
tie
yes, ma'am.
here. Also, this area. Make
Yes, 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 ma'am.
it.
Yes,
And do the ring massage 3-4 times a day.
3-4 times a day. Okay.
4 times a day. You
And
can do more also.
about color,
Color,
no,
orange color. Yes, orange color.
orange
Yes,
color.
2 hours.
For 2 hours. Okay. And ring massage, um, color for 2 hours. Then seed. Smokes
Yes,
also. Smokes also.
very good. Moxa is very good in chronic cases.
Okay. Thank you very much. Thank you.
Good evening,
Yes,
Smile ma'am.
Punita ji.
Smile, good
Smile.
evening, ma'am. Ma'am, actually, I'm 54 years now, ma'am. But I have been riding two-wheelers from like when I was in college and all. But of late, like two-wheelers, I ride two-wheelers, but sometimes that balance and all, one side if it falls, that knee pain starts, ma'am, after that. So what is the and means if I'm a pillion rider, I used to go put my legs two-way and sit in the bike like a horse ride. But now I'm not able to do that, ma'am, because I get when I get down off the bike, one side knee pain starts, ma'am. What is the reason, ma'am?
And did you go for a checkup? Do you have any medical
I'm
diagnosis?
a diabetic, ma'am. That's all.
Diabetic.
Yeah.
Okay. So of course you have to do pancreas point for sure.
Okay.
Along with that, lumbar point and knee point. This combination, and today you have understood, I think so. You have understood
Yeah.
how to treat knee points. Please
Yeah.
follow regularly, and please start using.
Yeah.
You all should have this, and
Yeah,
it is
ma'am,
very
I
easily.
have. Yeah. And ma'am, that's what when this off late only this problem that when I do exercises also, if I lift my knee too much, also that pain starts. Some angle it starts paining like that it is, ma'am.
Yes, yes. So now you don't focus why it is happening, what is the cause. Just start doing this. Whatever you have
Okay.
learned today, just do it with smile.
Okay. Thank you, ma'am. Thank you.
Yes, Meenuji.
And my right shoulder is so much pain. But this time you say point relief so much, but this place not relief, ma'am.
Yeah.
So much pain, this
Yes,
place.
yes. So shoulder joint we have discussed in detail, but this we have not discussed. This is like the area between shoulder and elbow. Yes, this is arm problem. So you have right arm problem.
Yeah.
Yes, right arm problem. So you see, now you will focus. Sometimes additionally we should do cervical points also if person is having. Also, I want to add this thing. This is very important. In all chronic cases, if person is having arms problem and arm joints of arms, or any part in the arm is having problem, then better you treat cervical also additionally. And if person is having leg disease or any joint in leg, then for this leg, all kinds of leg problem, treat lumbar sacrum region in last session. See previous day session. You will find how to treat this. So now you said right arm, yes?
Right.
Right arm, okay? So this area, see, in right hand, this area, and in left hand, this area. So you have to pay attention to this area, massage several times, 3-4 times a day, and along with the joint, right shoulder joint treatment, and then fenugreek seed around this area. Did you get my point?
Okay.
And this area.
Ma'am, I do moksha also.
Moksha is very good. If you can do, it is very good. So cervical and this area, seeds, of course, yes, seed you will do finally.
Ma'am, my left thumb is so much pain, this area.
This
So
area.
much, this
So
area.
much. Okay. For this, we are treating in left index finger below the nail. This area you have to do massage below the nail, because as per Sujok, thumb point is here. So anyway, exact point maybe now you don't know, but at least below the nail in index finger, below the nail do ring massage, and below the nail you fix up seeds, fenugreek seeds.
Below the nail, ma'am, so much pain. Below the nail.
Yes. Fenugreek seeds in this area.
Okay, ma'am. My second question is, ma'am, last time I asked you breast milk, my neighbor is not come. You give me point. I try this 2 days, good result, but 3 days not result is come.
2 days good result. It means please continue. It will give very good result. Yes, don't stop. So once body has given you good glimpse that this treatment is working, it means body needs more. Give this treatment. This is natural treatment. Okay. And you can mother also. You can teach the mother. She can do it on her own. If she can do every day, it is very good. Clockwise massage and just putting the seed, it is good.
Okay.
Natural.
I stop because I don't know.
No, don't stop. Don't stop. You see, try to understand the language of body. You did it for 2 days and you saw the great result, good result. It means it is working. So do it. If body needs more, you do it.
Okay, but 3 days not come now, ma'am. Then I confuse.
No, never stop, because this is natural. First of all, I want to say one thing. This is natural treatment. So don't worry. If you have to do more, please don't worry about this. Just do it.
Okay, ma'am. Thank you, ma'am.
Nicely with smile.
Smile evening, madam. Dr.
Smile.
Surinder Arora from Gurgaon.
Smile evening. Smile evening.
How are you?
I'm good.
Kindly suggest some method or points for getting rid of trigger finger.
Trigger finger.
Yes.
Which finger?
The finger, this is mine is right ring finger. It sucks here from here. Middle joint.
Middle joint.
Yes. When I fold it, it is not locked. I'm not able to open it unless I move it with the other finger like this. And painful also.
Painful also. So as I told you in previous case, as I told one of the participant, finger disease. So 4 fingers below the nail, apply orange color as I did it here. So you see these 4 fingers below the nail, apply orange color.
Okay.
Then of course ring massage. After doing ring massage, fenugreek seeds you can apply on 4 fingers. But color, you should leave it for 2 to 3 hours during daytime, and after that you can put seeds.
Okay. So the problem will be solved.
Of course.
How many days I have to continue for 15, 20 days?
You never know.
Yes. We can't
Yes,
say it
I
yet.
cannot predict. Also,
Yes.
you do cervical points also with this.
Okay.
Yeah. And ring massage, you do it more 3 times, 4 times.
Right. Thank you. Thank you.
Yes, please.
Good evening, ma'am.
Good evening. Good
First, I
evening.
must thank you for such a interesting and explaining it so calmly and so nicely. So, because I have learned basic Sujok before also, but the way you teach is a lot different than what I have learned. So I'm really impressed. Now, I just wanted to ask you. You said treating GB, harmonizing the GB when you have knee joint problem. So, will that harmonizing help the GB stone also?
Yeah, GB, of course, yes. All problem related to GB because gallbladder is an organ and also it is a storehouse of yang wind energy. So it has 2 purpose. One is gallbladder organ and second is yang wind energy.
Yeah. So I had 2 stones. One was 16 mm and one was 18 mm. Now one stone has broken down and there is only one stone. And other small stones are there. They're not troubling me at all, but it has been shown in the sonography.
Okay,
Otherwise,
so
I don't have any trouble with that stones.
Okay, so start doing moksha and black pepper on this point.
On the palm.
Yes, in gallbladder point.
Got it. That I got it.
Because you have already done Sujok, so for you it is very easy. You can search instead of focusing one finger. You can focus. You can, with the help of probe, you can check all gallbladder points, and wherever you find the painful point in that area, you focus your treatment.
Okay, I'll do moksha, massage it, moksha, and then put black pepper.
Yes.
That will help. Achha, now the gap in the knee has reduced and on the outer side, and I have got knock knees. Will that help?
Of course. Please do it and do it seriously, religiously, every day without fail.
The whole the knee joint, I'll apply methi seeds.
You can do it. If you can find painful point, it is very good. But if you couldn't find, please do it. You can cover this area with the seeds.
Because this is a chronic problem, and if I probe, so the pain is there around one side or the other, anywhere, both the knees, I got those problems. So
you cover this area, entire area you can cover with the seeds. In left hand,
middle joint.
Right hand, middle finger, middle. In foot also, middle to middle joint, like bichwa. Yes, you can wear that methi strip in this area, in foot.
Okay. So daily.
Yes, daily. Yes, Gunjanji.
Namaskar, ma'am. Ma'am, thank you so much for the lovely sessions. मैम आई वांट टू आस्क, जैसे हाथ की उंगलियों में दर्द होता है, अगर पाँव की उंगलियों में दर्द है तो क्या करना चाहिए? सेम?
So, like this is for hand fingers. For toes problem, you have to focus middle two fingers. In left hand, middle two fingers, and in right hand, middle two fingers, area just below the nail. This area. Orange color in this area. Yes,
Okay.
orange color, moxa, and seeds, of course. Seeds.
Okay.
If hand finger has problem, then these 4 fingers below the nail. If toes, then middle 2 fingers below the nail.
In the hand only, not on the feet.
Of course, you can do in foot also. Same transfer. After doing treatment on the hand, after understanding points on the hand, same points. If I said middle, if my answer is middle 2 fingers, the points are below the nail. Now, same thing, transfer on the foot. Can you transfer?
Okay, fine.
Middle 2 toes, below the nail, the same pattern. Follow. So, if you master hand, foot, just copy paste.
Okay. Thank you so much. Thank
Taji.
Namaste, ma'am.
Namaste.
Actually, my question is not related to drawing. It's related to my belt palsy. Last time I asked you, you told me you put paper shade on the point 4 hours daily. Only on left hand.
A voice is not. A voice is not clear. Please say again.
In last class, you told me the belt palsy point, eyes point. On left hand, left thumb, black paper. 4
Which
hours daily.
side of face is having this? Left face.
Left side.
Left face. So in left thumb, this area you have to, if you can find, actually finding painful point with the help of probe, this is like a very super fine treatment in all cases actually. So one by one you have to check. In this entire region you have to, because this is left face, this is entire left, and wherever you find the painful point, stop there and massage that point, give more attention to that point, and then you fix. This is actually accurate. In case you succeed in finding that strange sharp pain point, that point will cure you. Only
Madam, full
do
left side
that you discover this area with seed, but I highly recommend try to find the painful point. If you're not getting the result, please try to find the painful point. And do it every day. Don't leave your treatment, please. And in left thumb, this is left face. In right thumb, this is left face. In both thumb, do this treatment for a few days continuously without fail.
Vijay Bhaskar, sir, please speak.
Good evening, madam.
Good evening.
Hats off to you, ma'am. Lovely presentation. Very easy to understand, beautifully demonstrated. Thank you so much. I've become a great fan of you, ma'am. And I have a small question in you. Thing is, I've been having burning sensation in my knees for the last 3-4 months. And practically I had very high hypothyroidism maybe 2-3 years back.
Hyper.
Hypo.
Hypo.
Then I met a doctor and he said, you have been taking Theranom quite a long time. Will be having a lot of side effects. Then from that day onwards, I threw away the medicine and started acute touch therapy by one Mr. Rajesh in Bangalore. And you will not believe, ma'am, actually, I had a severe hypothyroidism, and now my TSH level has come to 7 without medication.
Very good.
So I have a lot of faith in this acupressure, acutouch, and all those therapies. And I just want to know this few clarity from you, ma'am. Actually, this knee burning sensation, and other one is fatty liver. These two are the
Okay, fatty liver we will discuss in our next session because I need to explain in detail.
Sure.
You can understand in just one
Yeah.
go. I explain it.
Yeah.
Need detailed explanation.
Yeah.
But knee point, because we have discussed, we have explored this topic, so we
Right.
can talk on this. So which knee you said?
Huh?
Which knee? Left or right?
More on the left, but little bit on the right.
So you have to focus both. Middle
Yeah.
fingers,
Fine.
both hand, middle fingers.
Yeah. Right.
Yes, middle joint.
Right.
Burning sensation. Yes.
Yeah.
So you can do one day blue color,
Okay.
second day green color, and you
Okay.
continue. One day blue color, second
One
day
day
green color.
green color. Okay.
And
Yeah.
then if you see dark mark, because if you're applying color therapy every day in the same place, then you have to give rest also.
Fine. Yeah.
Yes, skin should you should give rest, and along with that you will do seed therapy in this area, fenugreek seeds.
Okay.
And don't do moxa on this point.
What is the reason, ma'am? Actually, what is the reason for this burning sensation?
Can be actually many reasons, so we cannot discuss now.
Fine.
But don't worry about reason.
Okay.
Just do it.
Yeah.
Real massage you do on all joints.
Okay.
But more attention on this joint.
Fine. Thank
Yes.
you.
And in
Thank
and
you.
transfer on the foot, middle finger,
Fine.
middle joint, middle toe, middle joint.
Fine. Thank you so much. Thank you.
Thank you.
Yes, ma'am. So rest of the doubts, please ask in the group or in the next session, please. It's late for ma'am also. She'll be taking classes from morning onwards. So let us give a break to ma'am also. It's 10:40 already. So gratitude, ma'am. A smile. Thank you to you from all of us for this session. It was really great learning about all the joints. Especially some people find it very confusing, but you explain it so well that they can really remember it for a long period of time. And with usage, they'll understand it better. So gratitude, ma'am. Good night to you. Smile night to you.
Smile night. Thank you. Bye. See
Bye.
Next Monday, same time.
Yes,
See.
please. So
Bye.
at the same time, again, as usual, we have acupuncture therapies Saturday, 7:30 p.m. Again, Sunday, 11 a.m. So everyone, please keep following the group. And remember to please put your actual names in Zoom so that you can utilize that particular thing as discount for future sessions. Okay. So everyone, have a great night. Please follow all the day 1, day 2, day 3 videos. Make a note and please practice everything. Thank you, everyone. Good night.
Good night.
Thank you.